We'll get to Victoria's situation in a moment as well, but I want to begin with New South Wales. 10 new cases, most linked to existing clusters. How do you think the state's tracking?
Look, it's good to see those numbers come down again today, but of course they will continue to bounce around because we've got so many people in thousands now of close contacts in quarantine that will be continually being tested and either excluded as cases or found to be cases. The concern has been, though, that not all these clusters or individual cases can be connected back to either contact with known previous cases linked to the Avalon cluster, or even venues where we know that there may have been exposures occurring. So that's the concern, that we still have these missing links within those chains that we're not picking up. And indeed, even the Victorian cluster shows that we did have someone return from New South Wales who wasn't detected as a case and wasn't aware they were infectious. So that's the concern. There is still the potential that there's more people out there who are infectious in the community, probably not even with symptoms or very mild symptoms. So we have to be really mindful of that today, especially.
Now, we know New South Wales is known as having the gold standard when it comes to contact tracing, but as these exposure sites and cases all rack up, are we becoming too reliant on that, or should more be done elsewhere?
Look, it has to be a partnership. They've been doing a fantastic job of getting quite complex information understood and reported, and public notices going out very quickly with all the new cases. So that's really important. But everything everyone does individually and collectively helps the health department do their job more effectively. So when venues have records, it's much easier to follow up anyone who was there at a particular time. But also everything individuals do to stop that risk of transmission, even if you don't come across the virus. Just doing those extra precautionary things means that if you unknowingly are in a setting where the virus is present, that you're less likely to become infected. And that then has implications for all your family and close contacts, because they won't have to quarantine because you won't become a case. So all those little things we all do, and also the size of gatherings, all those other things at the larger level, they're really important for helping the health department get on top of this in the way they need to.
Now, they're digging their heels in about keeping that test at the SCG, saying that they still believe it's quite realistic. Are you staggered by that?
Yeah, look, I'm surprised at a 50% capacity. That's Victoria only had less than a third, in fact. And it is a bigger stadium. And I think in Sydney, if you've got people you don't know potentially sitting around you for many hours, that is a concern, given that we know we've got some undetected community transmission out there. So, if you have to have spectators, then I would be reducing that cap. But equally, it's arguably, while we still can't track down the links between the Wollongong and the Croydon outbreaks back to the Avalon clusters, then I'm quite concerned about having strangers sitting close together. You don't get 1.5 metres apart if you've got 50% capacity.
Yeah, and the other real sticking point is this issue of masks, recommended, not mandatory. But then you compare that to Victoria's rapid response, only 6 new cases today, and already masks are made mandatory indoors. How would you compare the two ways that that's been handled?
Yeah, we saw mask wearing go from 50% to 95, 99% once they went from advised to mandatory early in the second wave. And so making them mandatory does make a difference. And I do think when you've got community transmission that you haven't got a complete handle on, that's the time to make masks mandatory in those high-risk settings. So any shared transport and vehicles, any indoor closed spaces, or any outdoor spaces where you're there for a period of time and you can't keep your distance, then I think masks just can make that bit of difference. And it's something that we can all do that actually, as our Premier here in Victoria says, it's a small cost, but for a potentially big gain if it stops some of those critical transmission events that actually then mean the virus gets shut down in the community.
And just finally, some more positive news on the vaccine front, with UK approving the Oxford AstraZeneca jab, hoping to roll out on Monday. Obviously, we'll be closely watching this one to see how it plays out for us.
Yeah, absolutely. There are some real advantages to this particular vaccine. It's one that's easier to get out to people. It's cheaper. It doesn't have those same -70 degree freezing complications. It's also one that we can produce partly in Australia, so that does, in fact, really help us, get the vaccine out to people. It's also one where they've tested it for reducing infection, not just the COVID illness. And that's really important if we want to stop transmission in the community. So, watching, as you say, Andrea, watching what happens as they roll it out overseas, getting an even better idea of who tolerates it well, and therefore where we might use this vaccine over the Pfizer one will be something that we can also be looking at through January as our regulatory bodies make their final call when they make a full assessment of both Pfizer and AstraZeneca vaccines.
Certainly can't come soon enough. Catherine Bennett, thank you very much for your time this afternoon.
Thanks, Andrea. Happy New Year.